me. This is Megan now.
I can hear you.
Megan.
Okay, wonderful. I am going to I might actually start again real quick. Have you guys heard anything yet?
Nothing.
No.
Okay.
I saw the slide start moving, and I was like, hey, wait a minute.
Oh, no. And sometimes the audio is the trick on this. So let's just start from the top, shall we? Okay, so the line, I don't know a way to make myself the host, so all of you will be live, just so you know. You might want to hit mute on your phones in case you're going to be driving or, you know, doing anything like that, just so that we can get clear audio. But I think that this should work. So can everybody still hear me?
I can hear you.
I can hear you. Okay, perfect. We're going to start from the top. So step one, you might notice that we have a different name from last year. Susan G. Komen, Michigan was merged from 3 former affiliates, Mid-Michigan, Southwest Michigan, and West Michigan. We have local offices in each of those areas where we will hold our meetings. And what we're really excited about is that we've been able to centralize a lot of our administration to put more money into the community and still maintaining that local focus. So for those of you who are returning reviewers, please note that my email is different. It's at komenmichigan.org now. You can just hit the X when it pops in and auto-populates with the West, and that'll be removed from your email memory bank, so you won't have that confusion. My West email will still eventually get to me, but it takes about a day because it filters through a different email account for all of our old emails. I also included my direct dial line right at the bottom here, as well as my cell phone. So you guys can connect with me when you need. So let's see here. Orientation goals, we want to make sure that you are familiar with Komen's mission and strategies, as well as make sure that you understand your roles and responsibilities, and then to provide direction to reviewers about how to score your reviews. So let's see if I can get to the next one. Oh, organizer code, now I have it. My screen just changed, guys, I'm sorry. Okay, so Susan G. Komen was a woman who died of breast cancer, and as she was dying of metastatic disease, her sister Nancy Brinker promised to do whatever she could to end breast cancer forever. So 30 years later, or more than 30 years later now, Susan G. Komen is the largest grassroots organization in the world. We're the second largest funder of research aside from the government. That part of what our mission is handled by our headquarters through a national review board. So you don't have to be concerned about that. Instead, we use your expertise for the 75% of funds that stay here and are part of our community grants processes. So those allow us to really focus on what the community needs are. Let's see. So our review procedure starts with compliance review by our Komen staff. So that's me. I go through and make sure all these organizations are 501c3s or government entities, that their paperwork is in order, that they have the proper documentation, and that their application meets the basic criteria for the request that we can field as an organization. So don't be concerned about that level of compliance. Instead, you guys are really focused on the content of the applications and giving a substantive overview and review of the application. So I will assign all of the applications in GEMS tomorrow morning once you guys are all registered, for those who are not already registered. And then you'll have the opportunity over the next month before November 30th to review and provide comments on all of the proposals that you're scoring. In the first full week of December, we'll meet to do a review panel in each of our 3 service areas, and we'll start with the initial ranking based on your scores, and then you guys get to lead a really nice discussion that dives into what's really the focus. Where should we prioritize the grant dollars? Because as always, they are limited. So it's really your opportunity to hash out the details and figure out which program would ideally be funded first, second, third, fourth, fifth, sixth, seventh, all the way down the list. Once that process is complete and we have a slate of ranked applications, I take it to the board and present it along with our executive director, Jennifer Juergens. The board does an up or down vote to approve the slate. Generally, a down vote only comes if they feel that I have failed to adequately hold to the required process. But it's not a matter, there's no opportunity for cherry picking or moving one thing up or down on the list. The list that you present is the list that will be voted on. Once that's approved, we'll figure out how much money we were able to raise in the previous year, and then we allocate the funding down that list as far as we can go until we run out of dollars. And then I handle the award notification and contracting process. Sometimes even when we offer money, we find that agencies might opt to not take it. So our final grants will be announced once all of the contracts are completed, because we want to make sure that we're keeping the sanctity of the process before that happens. So when an award notification happens, I'll make sure to copy you guys in so that you understand what actually ended up happening as a result of all of this, and that's usually around March. Okay, so important dates. The review period will start tomorrow as soon as I can get all the applications assigned in GEMS, and it will run through November 30th. I'd love to have your scores in the system by midnight that night so that I can sort through everything and make sure we're ready for our meetings. Our review discussion panel meetings will be held December 8th, 9th, and 10th in our various service areas. I'll make sure to send out directions with parking information and all that kind of good stuff. We're also asking that you hold the following weeks a day open on that time, that week as well. Last year we had the unfortunate circumstance of 2 out of 3 of our meetings being snowed out with a blizzard. So rather than scrambling to reschedule once that happens, we wanted to be proactive and make sure that we just have that hold date. If you have any concerns about that, please just let me know as soon as possible. I do want to point out that our meetings will start at 9, but we're probably going to end before 3. Most of the time we find that before lunch, most of the discussion happens. Over lunch, there's a few more discussions, and then after lunch, we usually can finalize pretty quickly the ranked list for the board. So although we're giving ourselves the opportunity to really have that good, deep discussion that can be very important, I think the reality is that we'll be out closer to 2, 1 o'clock even. But that really, we want to just make sure that we provide the opportunity for you guys to have good discussion. I will present the slate to the board in January, and then award notification happens February or March. We go through contracting, and then the grants are finally awarded April through March. So, Code of Ethics. Let's start at the beginning, you guys. Conflicts of interest. If you or a close family member are an employee or a volunteer, or if you have been a grant applicant of any of the agencies we're dealing with, let me know as soon as possible. Your applications gave me a good idea of those, but if I missed something, please alert my attention to it. We'll look at it, identify if we can screen or waive the conflict or figure out a way for you to still participate in grant review. We haven't had an issue with that before, but it's very easy for me to say, like, if you're connected with Lakeland Health, you just won't review Lakeland's application, but you'll do the others. We'll go through the process for how to update your conflicts of interest, but the reality is feel free to give me a call and I can walk you through the process too. So you'll have access to all the applications. I expect to assign all the applications to all the reviewers who are non-conflicted. I find that it really gives us the best opportunity for both the scoring and the discussion if everyone is really familiar with all the applications. In West Michigan, we have 7 applications. In Mid-Michigan, we have 7 applications. And in Southwest Michigan, we have 3 applications. The other important part of our Code of Ethics is confidentiality. Make sure that you're not discussing your roles with others until the grants have been awarded, which again is not going to happen until early next spring. So I know that many of you are connected with Komen through other capacities, and we still, please continue to be engaged with us. But if you run into a board member, just don't mention that you're on the review committee. We really want to keep the board's decision of the funding lines and the reviewer's decision of substance scoring separate. We want to make sure that it's an independent process. And there is a formal code of ethics document that I'll send out with materials tomorrow for everyone to agree. For those who are newly registering in GEMS, you'll have the opportunity to review it and provide any conflict information. For those of you who are returning, we'll go through the process to update it if you need to. So, items to review before scoring. All of this information I'll either send you links to or I'll send you copies of in your materials tomorrow. The training webinar, as soon as this is done, we'll get the recording together. And I'll even try and do a quick cheat sheet about where we actually started our discussions because we had a little bit of delay with the audio this morning. If you have any conflicts, please let me know as soon as possible so that I can take care of that and we'll update your conflict of interest in GEMS if we need to. The other important documents for you to review are our community profile. We have a new community profile for all of Komen, Michigan this year. It's still in process. Our last section out of the 3 main components is being submitted next week. But in the meantime, the first 2 sections are very important for you to review and be familiar with. The QDR narrative is the quantitative data report narrative, and the HSPPA stands for Health Systems and Public Policy Analysis narrative. Both of those are available on our webpage, and I'll send links to those. I also sent links to them in the reminder this morning. We also have the full quantitative data report that was given to us from headquarters that covers all 20 of the counties. In the narratives, we've identified 9 counties that are particularly address 3 communities of interest. So you'll see those 9 counties focused on in the narrative section, but some of our programs are outside those areas, and they absolutely can request funding. We just want to make sure that their statement of need includes data from the full QDR report. So you might be able to, you might want to refer to it. You don't have to read the whole thing. It's about 85 pages, but you might, if the grantee is referring to something, you might open it up and take a look. And it also could be useful in other work, so feel free to use those. But please do read through the QDR narrative and the HSPPA narrative. Those have specifically impacted the choice of the priorities for funding this year. So our request for applications is the next thing to read through. It's always a good idea to know what we asked for so that you know if the application is on point or not. And that also includes our priorities for funding. So scoring criteria, I'm going to give you a document that has all the questions to consider for each of the scoring criteria, and it also has the scoring anchors included in it. It's just a Word document. I find in GEMS it works really well if I have the program open in a web browser and then I have my notes or my other documents that I'm working on in Word next to it. That way, if you by chance walk away and you get automatically logged out of GEMS, you won't lose everything that you wrote. Word gives you the benefit of an autosave feature. And then you can merely copy and paste your answers right into the blanks for the review comments and scores. So I'll be giving that with you to you with materials. The reviewer guide for GEMS I'll also send. It's a little bit outdated. They're going to have new ones, but unfortunately they won't until the end of this year, so that does not benefit you. But next year we'll have new ones. And then I'll also include these slides from the training webinar. Additionally, I'll send links to our KomenMichigan.org website. We have a number of the documents you'll need there. And then we are creating a grant reviewer page that'll have all of your information on a nice laid out page. But until then, I will just make sure to send you the links to where all the information you need is located. So, community profile. The first thing, and I think one of the best things that Komen does, is that we start with the needs. We want to make sure that our programs don't duplicate services. We want to make sure that they're addressing actual needs in the community. And we want to make sure that we're filling gaps and not, particularly not duplicating services. So it starts with quantitative data. We look at it and identify from the statistics like incidence, mortality, and late-stage diagnosis, who is most at risk of dying of breast cancer. So from these communities of interest, we particularly identified low-income, un- and underinsured individuals, and with a particular focus on African Americans in Muskegon, Jackson, and Berrien counties, Hispanic and Latinos in Kent, Ottawa, and Van Buren counties, and rural individuals in Montcalm, Cass, and Livingston counties. Now again, those are focus counties because they had some of the highest disparities between some of these statistics, perhaps terrible trends in some of these statistics, but that's not to say that we won't branch outside of those areas. It's just to say those are areas of focus because we've identified them as having some of the greatest need. So the next section was, once we identified those populations, we wanted to figure out what programs and resources and services are available to those communities. So we completed a very large spreadsheet process, and from that we created a narrative analysis that discusses some of those challenges. So perhaps translation and access to translation services might be a particular barrier for Hispanic Latinos, whereas rural individuals might have very few, for instance, treatment facilities in their area, and transportation might be a barrier there. So helping to identify some of those gaps where perhaps Komen funding can step in to help connect those women to services throughout the continuum of care. The continuum of care is something that we talk about a lot, and you'll see that it's one of the criteria for our grant reviewers or grant applicants to address this year. And what we mean by that is education is important throughout this entire continuum, but generally education is part of what gets you into that first screening services. From screening services, we want to make sure that women are connected all the way through to diagnostic services in a timely manner. This will help address that late-stage diagnosis rate. We want to make sure that women are following through with those follow-up appointments on time, on track to get a definitive diagnosis quickly. Because we know when you can catch breast cancer early, you have the greatest opportunity for treatments and greatest options for a good prognosis. From diagnostics, we want to make sure that women get connected with treatment support services, and afterwards we want them to feel supported in survivorship. So all of our grant programs had to make sure to address, even if they're only working, for instance, on the education front, how would they connect a woman with supportive services for survivorship? Or if they're running a community-based navigation program, how do they help connect a woman to existing services for screening that we have in our communities? So looking at the system itself and the health system that these populations of interest are in, we identified some probing questions that we're currently exploring in qualitative data. So we're doing interviews with survivors, grantees, and frontline providers. We're also doing focus groups with some survivors and community members. And eventually this will all be built into a final community profile that will be released early next year. So you can look forward to that. And we really hope this document helps you pursue other grant-making opportunities as well. It has a wealth of information to be used in your statement of need for any applicants if you work with an organization to be able to use in writing a compelling case for funding to other organizations as well. So funding priorities. Priority number one is screening access. We want to make sure that we're filling gaps in our screening opportunities. As many of you know, the Breast and Cervical Cancer Control and Navigation Program expanded their guidelines last year. Not only do they have a larger ability to serve caseload, but they also can provide navigation services. So in addition to screening, they can also help with diagnostics, and now they serve un- and underinsured women. So a woman who might have insurance but is facing a $5,000 deductible might not be willing to submit to an MRI, which can cost a few hundred to a few $1,000s. We don't want a woman to make that choice. Even if she has insurance, if the price is too unaffordable for her, breast and cervical will help serve her. Some of our programs help fill that gap as well, because even though breast and cervical can serve a lot of women, there are income restrictions. So sometimes Komen programs will do a wraparound and will cover a slightly increased percentage of folks at the poverty level. So for instance, breast and cervical can serve anyone under 250% federal poverty level. And if they're below a certain threshold, they'll even help them connect with Healthy Michigan Plan, which is expanded Medicaid. But if you make 268% federal poverty level, you don't qualify. But you might still have some of those same financial barriers to care. So that's where a Komen program would come in, either at a local health institution or at the local health department, to perhaps increase the qualifications for women up to 300% or up to 350% federal poverty level, so that those women can still get the services they need. Additionally, the Healthy Michigan Plan has taken over a very large number of the people who were previously served on the breast and cervical caseload. And the great thing about Healthy Michigan Plan is that it connects women with full body services. We're not just talking about body parts. And we know that breast health is a part of, it's a full body issue. Breast cancer is more than just breast. It has tie-in to other health issues. So we really like to see our screening programs connect with these existing programs. Again, we don't want to duplicate services. We find that it honors our donors' intention to fill those gaps and to use our dollars wisely to encourage referral to those programs. So for screening access, we really are looking for programs that fill the gaps and don't duplicate the programs, and instead they use the continuum of care and their collaborations and their partnerships to help connect women throughout the entire continuum. And this is focused on screening, but also diagnostics. We find that that's very important, particularly for high-risk women under 40. Their doctors may say you need more screening because of your high risk, and their insurance might say, yeah, but you're going to pay for it as part of your deductible. Well, in those cases, if it's unaffordable for the woman, again, Komen programs can step in to fill the gap as well. So the second priority is culturally appropriate education and community navigation. One of the things that we've recognized is that we have more opportunities than ever for screening programs. We have great partners like BSIP, like Healthy Michigan Plan, that can help take care of the screening, caseload. But often, a lot of those women have barriers. They have fears, and they might have some myths about breast health as well. And when we can work with community organizations who are already serving these populations, we find that if we can provide them with the right education, the right knowledge, the right connection to the right resources, they can really do a lot to dispel those myths, to help educate women, to reduce fears, and give a supportive environment to help a woman get a mammogram. So it's really focused on connecting clients to screening services on a community level. So these navigators would be community navigators. They wouldn't be necessarily a nurse, like a registered nurse, but they would have usually some level of certification from non-clinical navigator programs. And that is an opportunity that we can make suggestions to some of the programs that want to incorporate that they use some level of a certification program because they are available and they're free. So we want to encourage that kind of certification where we can. The other big focus of these programs is to reduce barriers. So they might have vouchers for gas, or they might have a taxi program, or something that they coordinate childcare with a local agency for a special screening night. So we also want to make sure that we're targeting our priority populations of African Americans, Hispanic, Latinos, and rural individuals. So some of these programs might be designed very differently depending on which population they're trying to serve. But in all those cases, we want to make sure that they have the right expertise at their hands to be successful. So if you're, for instance, if you're doing a community navigation program to Hispanic and Latino people, you're probably going to want to have someone who's bilingual on staff. So just making sure that those program designs include the culturally appropriate aspects to make sure that they're going to be successful in the program. Our third priority is survivor support. We recognize that both through treatment and afterwards, survivors have unique needs, social, emotional, but also well-being and wellness too. So we're really looking for programs that incorporate wellness and lifestyle intervention strategies, like nutrition programs to help breast cancer survivors understand the different ways that they can prepare their food for healthier living. Additionally, we know that survivors are more likely than non-survivors to gain weight, and weight has a correlation with recurrence. So wellness programs that include exercise, yoga, as well as those social emotional support aspects. We really love to see those programs combine different elements to make sure that a number of those needs of survivors are being addressed. So this is a screenshot of the How to Apply for Community Grants page. On our website at the top, you'll see in the center of that big bar is Community Impact, and right below it is this page. If you hover over it, it'll pop up. Otherwise, if you open up Community Impact, you'll also get to this sidebar, and you can open the How to Apply for Community Grants page. As I mentioned, the community profile is located right here in the center of the page by that kind of brown arrow. There's links to it there. I'll send it out with your information email tomorrow too. And then at the bottom, there's also a link to the GEMS portal. And then at the very bottom there, you'll see that bottom red arrow, Community Grants Request for Applications. Just below that on the screen, there's a couple of buttons, one for each service area, so you can review all of that. And again, I'll send this all for you tomorrow. But if you ever need to find it, this is the web page until we get our grant review specific one. So this year, our selection criteria has changed a bit. You'll see a lot of the same aspects to it, but what's really great is the selection criteria now matches your review criteria. So we'll have questions to consider for you that match the questions that our grant applicants were to address as part of each section. So you'll see that we have statement of needs, program design, which is kind of the heart and soul of the application, impact, organizational capacity, monitoring and evaluation, collaboration, and continuum of care. For each of these criteria on the Word document notes scoring sheet that I send you tomorrow, you'll see that there's questions to consider for each of them. As you're scoring, for all but the first blank is for overall impressions. The rest of the blanks match with the selection criteria. And for each of those, you'll provide a score between 1 and 7, as well as some written comments and notes. It's ideal if you look at the questions to consider as a reviewer and take some notes on those questions to help justify your score. Also, this is a great opportunity for suggestions for feedback to our grant applicants on how to improve. Like perhaps you have a suggestion, like this part was not clear and should be clarified, or it would be more compelling if you discuss these types of things. So there's different opportunities there for you to provide feedback. The feedback I give to the grant reviewers is anonymized, so don't worry about that. And we'll go through that in our next section. So the scoring anchors, as I mentioned, we'll do numerical scores between 1 and 7. We ask you to start at the 4. So start at a 4, and as you're reading through and considering all the different questions for that criteria, should that score move up or move down? This helps keep us kind of middle of the pack score-wise. You may score an application to be perfect. You should only have one perfect application, and it really should be exceptional. So we just want to make sure that we're starting at 4 and then moving up or down depending on how well they really address the issues for each of the criteria. And again, all of this will be contained in the scoring notes sheet. So our review panel meetings are happening in December. I will facilitate them. We've scheduled 5 hours. I doubt that we will take that long. We do have a 1-hour lunch. If you have any dietary restrictions, let me know. So this is your opportunity to discuss and rank the applications. Considerations include geographical distribution, the population served, organizational priorities, and in the end, we rank the applications for funding from the top of the list all the way down to the bottom. Rarely it happens. It actually hasn't happened for me yet, but if an application scores on average less than 3, it's not going to be funded. And that's just because we want to pick the highest quality programs to make sure that our dollars are well invested in the community. So if you need any help, here's my contact info again. And again, the note that I have a new email address. So I'm going to open up our next presentation unless there's any questions. This is a good time for a break. Any questions?
No, I'm good.
Excellent. Let's see. I'm going to start. The next slideshow. Here we are. Now we're going to talk about GEMS, everybody's favorite. So the granting management system was started a couple of years ago now, specifically to reduce our paperwork, to put everything in one location. Everything to do with any grant is centralized in GEMS, all my correspondence as well. That's where I get audited. If our grants were to be audited, this is where they would look for all the information. And ideally, we also have the ability to show and demonstrate impact with much more clear metrics through GEMS. And it also allows us some more time away from paperwork to build relationships with our grantees. It also allows a remote way for all of our reviewers to review as their time allows. So the system is open for business pretty much 24/7, aside from Monday mornings. Monday mornings between like 7 and I'd say noon, the system goes down for maintenance every week. So otherwise, you'll have time throughout this whole month to do your reviews in the GEMS system. So here's a link to the GEMS system. Copy that, put it in your browser, and then save it as a bookmark so you don't have to type it again. If you're a returning grant reviewer, use your same login as in the past. If you need help recovering your username or your password, contact me. The forgot password link goes to an info email box that only gets sorted like once a day, so I won't get your request probably for at least 24 hours. So it's ideal if you just contact me directly and I can get in the system and change it almost immediately. For new users, we're going to go through registration real quick here. So from that landing page, there's a little link at the bottom where that big blue arrow is that says register now. Once you do, it'll open up a registration page. When you fill things out, you'll see that there's these little pink go buttons, and you're like, oh, that must not be important. No, 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 it's probably the most important thing on this whole page. Each of those go buttons is actually a function for the form to fill itself out. So once you click the reviewer go button, you can select Michigan from the drop-down and hit the go button again. And then once you hit Michigan's pink go button, all of a sudden the affiliate blank actually populates. So it looks, you can actually choose the affiliate drop-down. Until then, it'll have nothing in it. So if you're filling out the form for registration, you're like, I can't select anything. Go to the previous pink go button and hit it and let your page refresh. I do want to note that the preferred browser is either Chrome or Firefox or even Safari on Macs. I have much less experience with Macs, so if you're using a Mac and you find something's not working right, give me a call and we'll try and troubleshoot it. Internet Explorer is not the preferred browser. It will not function in a few areas if you're using Internet Explorer. So preferred browser, again, Chrome or Firefox. So once you select your affiliate, it'll again hit that, you'll hit that pink go button again, and then all of a sudden the organizations will populate. These organizations will be specific to your affiliate service area. So even though it says Mid-Michigan affiliate right now, what it really means is Mid-Michigan service area, because each of our profiles are still separate in the system. Now, once you hit that reviewer option, that pink go button, all of a sudden the new form, the form kind of extended itself, and there's a whole new reviewer section. So this is a screenshot of what that looks like. In addition to current place of employment, the next blanks talk about your experience, and then finally at the bottom, it gets into a conflict of interest section, and that's what this looks like. So you'll fill out the date, you'll identify if there is or is not a conflict, and at the drop-down center area, let's see, right here is where it'll populate all the organizations who are in our grant system. I'll send out a list of the grant organizations that have applied so that you can just take a look at that, but those are the most important to know. New reviewers, complete all this form, and then the next thing you're go back up to the top and here's this pink save button. Once that's done, I'll get an email that says someone new has registered in the system, and I'll log on and approve you. If you are a returning reviewer and you have a new conflict, we're going to want to update your conflicts of interest. So from your home page, you'll see at the top, one of the options is My Conflicts of Interest, where that red arrow is. I tried to color code the steps for what you press. Start with the red arrow, and it'll open up this page. Don't fill anything into the blanks for the search. The next step is just to hit that execute button at the top next to the orange arrow. And then once you do that, it'll open up this results at the bottom, and this is your conflict of interest document. So you'll go ahead and click that blue hyperlink where the yellow arrow is, and it'll open up a page like this. So the first thing to do is to change the status, because right now you're in verified. You're ready to go from last year. If you have an update, select Change the Status and apply the COI Updates in Progress status. Once you click Apply, it'll kick you back to this page again, and then you're going to go into the View, Edit, and Complete forms, and you'll actually update the document itself. So once you open up the Forms menu, it looks like this. You just click on the Declarations link here, and that will open up a page like this. So this is your actual declaration. At the top, if you're an existing user, you'll have an Add button now that you changed the status. If you don't change the status first, you won't have an Add button. So you click the Add button, and then you'll be able to complete the blanks down here. So you'll be able to identify the organization and put a note. So for instance, if your husband used to work at Spectrum Health, that would be the note that you would put in there. And then it gives me an opportunity to review and assess any conflicts we have. Once you're done with that, you're just going to hit the Save button that'll show up at the top. And then to get back to the forms, or to get back to the actual menu, you're going to click this. And this is a navigation secret for the entire system. This document ID at the top, the COI, HO, whatever, will get you to this page no matter where you are. So this is what your menu looks like on the top. The second option is Change Status. And once you click View Status Options at the bottom here, this is what your screen will look like. And here you are. To submit it to me, you just say COI verification required and apply that status. If anyone needs to update their COI and you're an existing reviewer, feel free to try these steps. But also, if you get stuck, just give me a call, send me an email. We'll work through it together. So now we've gotten everyone registered. This is what your home page looks like. So we've got a few things just for navigation at the top. You'll see Home, My CG Applications. If you're an interviewer, you might have My SG Applications, and then you'll also have that My Conflict of Interest at the top as well. So from here, when I assign you an application to review, it should show up in your My Tasks list. And you'll just hit right next to that big blue arrow, the Open My Tasks. When you do, you'll probably see a number of applications listed across here. To open up each application for review, you're going to click on the Doc ID. Again, this is similar to the one that will show up at the top of a lot of pages. Once you click that Doc ID, it brings you to the application menu. So this is what the application menu looks like. There's the main section that you guys will be working in is right here, View, Edit, and Complete Forms. So when you open that up, this is what the actual application is. You'll see there's blue hyperlinks to each of the different forms that our grantees fill out as part of their application. Essentially, they're each a different page of the application. And to review it, you can just open each of those blue links, flip through each part of the application. I would suggest having your Word document that you're scoring with open next to it, so you can take notes as you go. And maybe you have some questions or anything else. Just take the notes as you're going through, and maybe note a few pages that you want to look a little more in depth at. That'll help keep you organized as well. Just save a Word document for each of the grants that I'm reviewing so that I can take those very easily. So as you're scrolling through each of these pages, you'll see eventually at the bottom there's a section called Review. By golly, that's your part. So we have the compliance checklist I have already taken care of. No need to worry about that. The peer review section is where you'll spend most of your time. So once you've had a chance to review the application and taken those notes in your Word document, go ahead and open up the peer review section. It will open a page. Oh, here's what the scoring note sheet looks like. Gives you some criteria, it gives you the anchors, and then below that will be each of the questions. So this is where you want to take the meat and bones of your notes. Once you click open that peer review section, this is what the peer review menu looks like. Up at the top right-hand corner is the review panel. This is where you actually enter your notes. If you want to take a look at the scoring anchor definitions, it's over here, but again, I include those in the Word document notes sheet, so you can just look at it there. Once you open the review panel, it's actually kind of a pop-up in the window browser, and it looks like this. You'll see the first part here does not have a score drop-down. The second one does. This first section is just for your overall comments. What was your overall impression? Would you recommend this application for funding? And then below that, you have each of the criteria. So here we have statement of need first, and next to it are the questions to consider. Again, all of those will be included within the Word notes sheet that I'll send you. So this is where you'll enter your score and eventually copy and paste your comments right on into the form. Once you're done with that, and you want to finalize your score, all you do at the bottom one is type in the word complete. Once that's done, save your review panel and then close your review panel. Again, the save button is critical. Just make sure to hit save anytime you question it. So now we went over how to find the review panel. We went over how to drop in all of your scores and where to put your numerical score as well. So once you've done that and you put the complete in that blank, it's done. I'm going to check to make sure that that says complete, and if so, I'll know that I can grab your scores and start tabulating the final rank or the ranking sheet for the initial start of our meeting. So now you've gone, I want to tell you guys how to print the application. Sometimes it's nicer to just look at a single PDF rather than page by page looking through the application in the portal. So from the application menu, which again, you can get to using the Doc ID either at the top or out of your My Tasks. Rather than clicking into the forms here to look at each individual form, go down to, and you'll see a space called Access Management Tools. This is where you can open it up, and the first option is Create Full Print Version. So that's what you're going to do. Click this link. Your browser will download a PDF, and you can save it, to your desktop or in a grants folder. Just make sure to save it with the name of the applicant, because it'll just spit out numbers as the download. But then you can go through that and open up the PDF and look at all the different sections of the grant, and then take your notes again in that Word document next to it. I kind of like this better because I don't like navigating between all the different pages over and over. So this is a really easy way to just open up the Access Management Tools and download a PDF of the application. You might notice that the application, one of the questions in the West application particularly printed out strange, and instead of saying collaboration, it says number 1. And instead of saying continue with care, it says number 2. If there's anything like that, just take a look back in the system to make sure what it's about. But that's the only issue I've seen so far, is that collaboration and continue with care might not have copied properly into the system. So you know how to find a PDF version to print that and save it as well. So we've gone over a lot of this, but here's some more helpful hints. Use the scoring notes sheet to draft your reviews and scores. Save a file for each of the grants that you score, and then just copy and paste your notes into the GEM system. If you copy and paste from Word, you have to hit the backspace or the space in order for the character count to go right. I don't think that's a concern for any of you because I think you'll be able to fit within the character limits in the system very easily. Make sure that always hit save to save your data. If you navigate away from a screen, before you hit that back button, hit save. Because if you don't, it's automatically lost and you might not even know it. The system will automatically log you out after 45 minutes of no activity. It only gives you 3 minutes of warning. So just make sure that as you're going through to move between different pages or to save your work constantly to prevent yourself from losing anything if you do get locked out, or logged out rather. The browser back button seems to be working better than the in portal back button, so I'd suggest using that. And then we already showed you at the top of most of the pages, there's a blue hyperlink Doc ID once you're in an application that'll bring you back to that application menu where you have the forms sheet and you also have those access management tools. So now is an opportunity for question and answer. Do we have some questions? You can submit via the chat, or if you're on the line, feel free to ask any questions.
Megan, this is Nora Bass. I have what may seem like a silly question. Do you, for the reviewers, are we specific to, like, for me, Southeast Michigan only, or do we get review applications from all different parts?
You'll be specific to the region where you're from. So, Nora, for you, it's Southwest Michigan, I believe.
And that's fine. Yeah.
Yep, and we do that because, you know, each of you really kind of understand the needs of that local population, and the connection that we want for our reviewers is that local connection. So we make sure that, you know, we have a voice from varied geographic regions as well as varied backgrounds for each of our committees.
Great, thank you.
Yep. So that means based on which region you're in, if you're in West, you'll have 7 applications to review. If you're in Mid, you'll have 7 applications to review. If you're in Southwest, we received 3 applications this year. Any other questions?
Megan, this is Betsy from Southwest. At this time, do you have enough reviewers for our region?
At this time, I have enough reviewers for all of our regions. I think I have 5 or 6 for Southwest right now. So,
okay.
Yeah. So I think that most of you are already registered in GEMS, but for any of you who are not, I would ask you tonight, or even right now if you have a minute, to open up the link to the affiliate grants page and take a moment to register. And once you do that, I'll be able to approve you. And if we have any questions, feel free to give me a call. I'll be happy to troubleshoot so that tomorrow morning I'll have everybody already ready to go in the system and I can start assigning all the applications. Similarly, if anyone has an update for their conflicts of interest who is returning, let me know, and I'd be happy to walk you through the process to update it. But I want to make sure that that gets taken care of by tomorrow as well, because the COI has to be updated prior to me assigning all the applications. And let's see, this webinar will be the recording will be available tomorrow. I'll send all that out along with the materials for each of you to review to help as you go through the reviews. So let's see, any other questions? Okay. Well, thank you all very much for your time. It really, I can't stress enough how important it is to have your service. So thank you very much. And I look forward to meeting you at our meetings.
Thank you, Megan.
Thank you.
Thank you.
Thank you.